Good morning, everyone. Thanks for those who are able to attend this morning. Like Dr. Delos had mentioned, about 1 year ago, I had talked about heat exposure and heat-related injury in the workplace. So I thought, it might be good to talk about the flip side of the coin with cold exposure and cold-related injury. So before we get started, just as a disclaimer, nothing to disclose here. Pretty much standard. Anything that I'm presenting is my own opinion, of course. So why is cold exposure important? Of course, anyone exposed to extreme cold, whether or not they're in the workplace or just in a cold environment, could be at risk for cold stress. And this can actually vary across different areas of the country, mainly speaking because not everyone is used to or accustomed to winter weather. So different regions might have different definitions for what they consider to be cold stress. As temperatures do drop below normal and wind speeds increase, of course, heat is more rapidly transferred away from the body. In terms of heat loss, a majority of it is via radiation, so direct emanation away from the body. And actually, due to a lack of standardized reporting, it's really difficult to say what the actual incidence of cold injury is, mainly because it seems to be difficult to say based on current data, since not all cold exposure, based on death certificate data, is actually reported as cold related. There are situations where deaths are listed as cold having being a contributing factor. And when that's done, for the time period when that data was overlapping between death certificate data and cold being reported either as the underlying cause or contributing factor, when it's factored in as a contributing factor, the death rate actually does increase. It's actually more than double for most years. And this was based on data from the EPA, Environmental Protection Agency, for a period from 1999 to 2015. So when that is factored in, deaths where cold was listed as a contributing factor, the estimates did actually increase versus considering deaths where cold was only listed as the underlying cause. But again, there is year-to-year variability in the data as well, too. Depending on the year, with the flu season, other respiratory illnesses in the winter season, that can also be a factor as well. And like I said, depending on the region of the country that you're concerning or regarding, definitions for cold exposure do vary. Of course, in more northern tier states like Alaska, Maine, what's considered cold there would be much different than what's considered cold in Florida, for instance. So in terms of classifying the classification codes used for code, there were changes made in the late 1990s. So it's very difficult to say if there has been a meaningful increase or decrease in deaths listed as cold related over time. So before getting further into kind of the medical aspect, I thought it would be good to just go over some basic definitions for weather, kind of similar to for those of you who attended my heat presentation, did something very similar. So the National Weather Service does have definitions for what's considered a watch versus an advisory versus a warning. So for those who might not be aware, a winter storm watch is typically issued at least 24 hours before a storm is about to hit. So this basically indicates that there is a chance of a hazardous winter weather event occurring. It's about a 50% chance of it taking place. And the way they define a hazardous winter weather event, it's basically 5 inches or more of snow or sleet within a 12-hour period, or 7 inches or more of snow or sleet within a 24-hour period. In addition to that, there could be enough ice accumulation that it is causing damage to trees or power lines. And also, it presents a life-threatening or damaging combination of both snow and ice accumulation, with wind as well, too. So any of those three three descriptions basically could qualify as being a hazardous winter weather event. With a winter storm watch, the location and timing is still uncertain. Again, it's just that it will occur. It doesn't mean that it will occur, it's only that it is possible. But having this type of notification in place, it does provide enough time for arrangements to be made, not only at the workplace, but in general for people to make plans in order to stay safe during the alert. So as an event becomes more imminent, the watch will typically be upgraded to either an advisory or a warning. Once this happens, it's a greater probability of occurring. Instead of a 50% chance of occurring, it's bumped up to at least an 80% or higher chance that it will happen. With an advisory, it's basically considered to be a potential threat to life and or property. However, a warning indicates that it's definitely going to happen. That there is this threat to life and property, and also travel is going to be extremely difficult. So in terms of a spectrum, just to review, you have a winter weather watch, then that could get upgraded to either an advisory or potentially worst case scenario, a warning that this is definitely going to happen and it's something that people should be aware of and take the necessary precautions because it could be life-threatening. So in terms of winter advisories, the two that the National Weather Service has in place, one is a winter weather advisory, of course, and it's one or more of the following three things, which I've listed here: snow accumulation of 3 to 5 inches in 12 hours, sleet accumulation up to a quarter of an inch, or freezing rain in combination with sleet or snow, or even blowing snow, to be honest. Just for those who might not be aware, sleet is considered to be rain that turns to ice pellets before it actually reaches the ground, whereas freezing rain is rain that actually freezes once it hits the ground itself. So this can create an icy coating on roads, walkways, trees, even power lines as well too, which can potentially create a work hazard for those dealing with electricity, of course, electrical maintenance. And there's also, of course, a freezing rain advisory as well too, and that's with ice accumulations up to a quarter of an inch. In terms of warnings, the three that the National Weather Service has in place are winter storm warning, and this is when heavy snow of at least 6 inches in a 12-hour period or 8 inches in a 12-hour period is to be expected. It can also be issued if sleet is going to be accumulating for at least half an inch. An ice storm warning, of course, which would be when ice accumulations of at least 1 to 4 inches is expected. And then a blizzard warning. With a blizzard warning, it's a combination of two factors: low visibility of less than a quarter of a mile due to the active snowing, or it could even be blowing snow. And also wind speeds of at least 35 miles per hour. So the combination of those two factors, which is expected for at least a duration of 3 hours. Now, interesting to note that with a blizzard warning, no temperature requirement is needed. As long as it meets the low visibility requirement and also the wind speed minimum of at least 35 miles per hour, it can qualify as a blizzard warning. And this would be expected to occur within the next 12 to 18 hours is when the blizzard is expected to happen. All right, polar vortex. A lot of people might have heard this term being thrown around as well too. Basically refers to the low pressure and cold air at each of the poles, the North Pole and South Pole. And it always exists at the poles. This is a phenomenon that is always present. It's typically weak in the summertime, and it does strengthen during the wintertime. And because it occurs at the poles, hence the phrase polar. Vortex actually refers to the airflow that's taking place, and this is in a counterclockwise direction, you'll actually see that I have a figure on the next slide, which will go over that. And basically that keeps the cold air near the poles themselves. However, during the winter time, especially in the northern hemisphere, the polar vortex will expand, and this can potentially send cold air southward as a result of the wind jet stream. And this occurs fairly regularly during the winter time, and it basically introduces Arctic air into the US further below. So over here, you'll see just a figure. I'm not sure if you can see my mouse, but on the left side, when the polar vortex is stable, basically all that cold air is contained at the North Pole here. You have the jet stream, which is also encircling it, basically creates a barrier there to keep it in place. But it does get disrupted. It can expand, and of course, with warmer air moving northward, this can also impact the jet stream, which will kind of buckle under that pressure. As a result, the cold air will move southward, and not only can it affect the US, but also other regions across the northern hemisphere as well too. So just to keep this in mind, the polar vortex, it's not really something that is new. It might have been more recently popularized, people using polar vortex is more of a buzz term, but it has always been present. It's not a feature that exists directly at the Earth's surface. This is basically taking place in the atmosphere, thousands of feet higher up above the surface of the Earth. And like I said, it's not just confined to the US. It can also have an impact in Europe and especially northern parts of Asia as well too. The main concern here with the polar vortex is just how cold temperatures will be when the vortex does expand, because that is going to shunt Arctic air southward, and potentially it could get shunted to areas that are typically not well-versed or able to handle cold weather. So that could be an issue. In terms of other cold definitions, which people have heard, I'm just going to run through these really quickly. Nor'easter, I should say. Basically, that's an eastern coast storm on North America. Basically, the winds are traveling over coastal areas, and that's typically from the northeast, which is how that winter storm got its name, nor'easter. Usually, the more violent storms are occurring anywhere from September to April of a given year. Frost, this is basically when thin ice crystals can form on surfaces, not necessarily the ground, but also other structures as well too, such as trees. Like you can see in this photo, due to the weight of the frost accumulation, the ice accumulation, it is causing the tree to buckle, branches to bend over, and this can be concerning from an outdoor perspective if you're working outdoors, even also with power lines as well too. Frost can accumulate on power lines, present a weight hazard, and potentially cause disruption in services as well too. Black ice, this is basically patchy ice that can form on roadways or transportation surfaces. It's not easily seen because, again, it can be kind of a thin, clear level that you see on the surface. And especially with the lighting too, it's very difficult to ascertain. The photo on the left here, this is during the morning. The one on the right is from nighttime. Again, it's really difficult to say here because since that layer of ice is so thin, you can see the black road surface visible underneath, hence the name black ice. There's also the chance that even if black ice isn't present, if snow is on the ground and it does have a chance to melt, and let's say refreeze overnight, same thing with rain. If the roads are wet and overnight the temperature does drop below freezing, that can present a potential travel hazard. With the roadways and black ice formation, definitely travel considerations would need to be taken into consideration. Lake effect snow, so this occurs mainly in the Midwest along the Great Lakes region. Typically, it's usually in the late fall and winter season, and with the cold air originating from Canada blowing down to the Great Lakes area. Avalanche, definition of that is a rapid flow of snow down a hill or a mountainside. It can occur during certain times of the year. Certain types of locations might be more naturally dangerous for avalanches. And you can see in this picture right here, it almost looks like a cloud, but no, this is actually all snow that's traveling down this mountainside here. And interesting to note that in 90% of avalanche incidents, it's oftentimes human triggered. So oftentimes either the victim or someone in the victim's party is responsible for causing the avalanche versus it happening more spontaneously in about 90% of avalanche cases. And usually avalanches kill about 150 people worldwide each year. Um, some warning signs of unstable snow and possible avalanches to keep in mind are that you might actually see evidence of previous slides in the mountainside, depending on where you're at. If you do notice cracks form in the snow around your feet while in the area, sometimes when walking, the ground might actually feel a bit hollow. That's also a warning sign that it could potentially collapse. And also, if you do hear like almost like a wumping sound, it kind of indicates that the snow is still settling. So there is a chance that if the snow is settling, if it continues to slide, potentially a slab of the snow could shift in place. If there's been heavy snowfall in the past 24 hours, that's also a risk factor for a potential avalanche. Also rapidly increasing temperatures as well too. With the melting snow, that can also potentially cause a shift in the layout of the snow and cause a slide of the snow, depending on the angle of the mountain area. And also, if there has been indications where the snow has been moved by strong winds, that it hasn't just naturally laid in the area, it actually was carried to that area from another location, just given heavy wind gusts, that can also be a potential risk factor as well too. And lastly, with snow squalls, I believe a few years ago, New York City actually had a snow squall. This is a really brief winter weather hazard that occurs. It moves in and out of the area quickly. Typically, it lasts less than an hour, but it does cause a sudden whiteout. It's very difficult to see. It can create icy roads in just a few minutes, given its intensity. There's no large-scale winter storm progression, so the squall is very brief. It just happens momentarily, but it just causes such an extreme impact in that localized area. And it can result in deadly traffic accidents. It can basically put things at a standstill, even though typically, usually in terms of snow accumulations, it's less than an inch or so. But the strong wind gusts with the falling temperature and the quick reduction in visibility, it can be extremely dangerous conditions for motorists and also for travelers. This picture right here in the right corner, it's from 2009. It might be a bit difficult for you to tell, but this is actually an airport during a snow squall. It was actually in Burlington International Airport up in South Burlington, Vermont. So of course, when the squall occurred, all air travel was at a standstill, basically paralyzed for that moment, just given the intensity that snow squalls can present. So with regards to the impact of cold on the human body, so now we're going to kind of transition into the medical impact. I'm sure most people have heard of wind chill. It's basically the rate of heat loss from the human body. It's a combination of the effect of the low temperature and also wind on the body. So as wind increases, it's carried away from the surface of the heat. Heat is carried away from the body at a faster rate. Again, like I mentioned earlier, radiation is about 65% of the heat from the human body is released via radiation, so from the surface of the skin itself. So with increasing winds, of course, that's going to increase the transfer of the heat away from the body. So naturally, skin temperature is going to decrease. And eventually, over time, of course, the internal core body temperature will also decrease as well, too. So on the right side, you can see this chart. This is from NOAA, uh, their organization, which basically is also responsible for the National Weather Service. They've created a scale in terms of wind chill change over time. So as you can see here, going from top to bottom, wind is increasing and temperature from left to right is decreasing. So you'll proceed from the lighter shaded areas to the darker shaded areas over in the right corner here, the dark purple areas. And basically what this represents is the how long it will take for exposed skin to become frostbitten. And in terms of frostbite, that is something that we will talk about a little bit later on in the presentation. But in terms of how the body reacts to cold, cold stress versus cold strain, something just to keep in mind in terms of those definitions. Cold stress basically refers to the environmental conditions in which the body is losing heat to the environment at a rate faster than the body can actually produce heat. So some factors which we kind of already touched upon, of course, the air temperature, humidity, that'll be a factor, the wind chill that's present. What rain can also be an important risk factor as well too, since being wet, that can also increase the transfer of heat away from the body too, as well as also the clothing that a person's wearing. Big risk factor in terms of whether cold stress will occur. The wind chill chart, like I said, it basically provides an estimate of the cooling power that's present based on the wind and the ambient temperature. And also important to note that people riding in open vehicles, even if the wind velocity, the wind speed in the environment is low, depending on the travel speed of the vehicle, that could potentially generate a cold wind chill. It could reach even dangerous levels. So something just to keep in mind. When someone says cold strain, that's more referring to the body's actual reaction to the cold stress. So physiologically, what is happening to limit body heat loss in the moment. So of course, there are vascular changes. So blood flow to the periphery, to the extremities, is going to be constricted. It's going to be shunted so that more blood is conserved at the core towards the midline of the body to preserve that temperature. There is an increased production of metabolic heat, and studies have shown that the liver actually is one of the major organs that does help with thermogenesis by the body during times of cold exposure. And also shivering as well too. Shivering is basically almost an instinctual reaction, a reflex to cold exposure. Nerve impulses from the hypothalamus are relaying messages to the skeletal muscle, causing them to rapidly contract. And that rapid muscle contraction is what results in heat production as well too. So in terms of cold stress, if it's not able to be managed adequately by the body's compensating mechanisms, then of course it can really result in cold injury and illness. As a person gets colder, they might notice muscle stiffness, decrease in blood pressure, of course, because again, that blood is being shunted more towards the core body to keep the cold temperature elevated during these times. There can also be cardiovascular risks as well too. A lot of stress is placed on the heart during these times as well. Oftentimes we have heard of people having heart attacks during the winter season, especially when cleaning snow. And it's not just the physical activity of cleaning, shoveling snow, but it's also due to the fact that with the winter weather, of course, blood is being shunted to the core. The heart itself might also have difficulty pumping blood to the extremities to keep your muscles active while you're physically shoveling or engaged in work in the snow. So that can, lead to an increase in the incidence of heart attacks that we do see. And also a decrease in the respiratory rate as well. So you might notice a bit more labored breathing the longer things go when being in a cold environment. So not only just the physical impact, but there is also a psychological impact, a mental impact to the body's loss to heat. You can notice some mental slowdown, even poor judgment. Some people, if the cold is really, really getting to them, they might actually start removing their clothing, thinking that might help with the situation, especially if they are having difficulty breathing. They might think that removing those layers of clothing might help them breathe a bit better. And also, in terms of level of consciousness, a person can be waxing and waning, and sometimes eventually it could lead to potential loss of consciousness. A person could fall into a hypothermic coma if left unattended. So in terms of the cold-related injuries that I'll specifically be going over in the next few slides, it'll be these four right here. So to jump into it, hypothermia, I'm sure we've all heard of this. Basically, the body is losing heat a lot faster than it can generate or replace that heat with its natural mechanisms. So the normal human temperature, 98.6, it's going to be dropping. Typically, usually, once it drops to less than 95 degrees Fahrenheit, that's what is considered to be a hypothermic condition. Um, and most likely, of course, this can happen at very cold temperatures. However, important to realize that it can even happen at cool temperatures above 40 degrees, especially if the person does become a bit cold or chilled from rainfall. If they are working outdoors or indoors in a cold environment, if they are generating a lot of sweat from that physical activity, that sweat cooling down can also present a risk factor as well too. And also submersion in cold water. And I'll actually be talking about that on the next slide. So in terms of mild symptoms, with hypothermia, it is progressive. It can start on a spectrum from mild to moderate to severe. So in terms of mild symptoms, the worker might, or person rather, could still be alert, but they might seem a bit more fatigued than usual. They may try to, stomp around, jump around a bit to generate some heat. They may be shivering. And that shivering can progress. It might be more mild to severe, almost uncontrolled. They're not able to stop shaking. And once it gets to a severe state, shivering might actually stop due to muscle fatigue. The body is just not able to compensate. Uh, a person may lose coordination of their extremities. You might notice them kind of fumble with things. They might appear confused and disoriented. Again, that's more the mental aspect, the cognitive aspect. They may have difficulty standing. And in severe cases, of course, blue skin, dilated pupils, their pulse slows down, breathing becomes slowed down to a point where they may lose consciousness. And this can be potentially fatal if the person does not receive help immediately. So what to do in these situations? Of course, you want to get this person help ASAP, call 911 immediately. On the work site or outdoors, if you're able to get that person to a warm area or even a vehicle just so they can warm up, that would be the most ideal situation because that person's not, depending on their state of mind, they might not be able to help themselves. They might not be able to think clearly, know what's going on, or even be able to move to a warm area. So they are going to require assistance. If possible, if they are wet, the clothing that they're wearing is wet. If it's possible to replace that clothing with dry clothing, that would be ideal. But if not, you want to raise that person's temperature. So you want to cover their body with layers of blankets. Definitely want to cover their head and neck as well too. Um, Also, if possible, like as a top layer, having like it could be a garbage bag or a tarp. This is basically providing a vapor barrier. So any heat that's going to be generated by kind of bundling this person with blankets um, is going to generate and kind of warm the air surrounding that person. So with that barrier layer, garbage bag, tarp, whatever, it'll keep that air in place so that it'll help with the rewarming process. And of course, you don't want to cover the face. So like you can see in the picture to the left, of course, keeping the head covered, that can help, keep the warmth in, wrapping the person so that it's at neck level, that is okay too. But in terms of the face, especially if the patient is unconscious, you want to keep that area exposed. If the person is alert, it is fine to give them warm beverages to drink. This can also help increase the core body temperature. And as you're increasing the core temperature, of course, this is going to help with blood flow being shunted away from the core back to the extremities, that warm blood being pumped to the extremities, to the arms, the legs. That is also going to help with the rewarming process. So of course, you want to focus on warming from the center of the body, then, the periphery. So in the case of hypothermia, of course, focusing on the chest, neck, head area, also the groin as well, too. If you do have warm bottles or hot packs, they do have like chemical hot packs, which can be snapped and placed at the person's armpits, sides of the chest, and the groin area, and then wrapping that person in an overlying blanket or a tarp of some kind. That can be very useful. It might not also be, it might not be possible to have an electric blanket. Depending on the work site, especially with outdoor work, having a portable electric source might not be available, but again, can be something to consider. And of course, if the person is not breathing, has no pulse at this point, if it's severe hypothermia, you of course want to start CPR at that point. So in terms of immersion hypothermia, so this is with cold water immersion. This can actually lead to hypothermia developing much more quickly. And the reason for that is, like I alluded to earlier, with moisture being wet, water can actually conduct heat away from the body about 25 times faster than air. So this can actually, with immersion hypothermia, it can occur in any water temperature actually above 30 degrees Fahrenheit. It really depends on the situation and also how long that person is exposed to the cold water. So in the figure to the right, you can just see 4 stages of cold immersion. I'll just run through these really quickly. With stage 1, cold shock. So this basically occurs with sudden entry to the water. A person falls into the water, they might actually get submerged. That sudden exposure to the cold water, it causes a reflex gasp. So the person actually takes a breath in, uncontrollably as a reflex because of that sudden weather change, that sudden temperature change, being exposed to the cold water there. So because they are gasping as a reflex, water is entering the lungs and can cause, of course, damage to the lung tissue. Especially if the person is submerged, if they're not able to adequately recover and kind of bring themselves above water level, drowning can occur almost instantaneously. So if a person realizes that they are about to fall into the water, it's really important to try your best to cover your face with your hands. And what you're trying to do is, especially with your mouth, you're basically trying to block your mouth, cover your mouth to prevent gulping any water in your lungs due to that reflex action. So that's pretty much why it's referred to as cold shock. It's basically the shock of entering the cold water unexpectedly. Swimming failure. So of course, this can occur with prolonged time in the water itself, especially if you don't have a life jacket or some manner of flotation device there. And mainly this happens because of loss of manual dexterity in terms of muscle control to the arms and legs. As the extremities do get colder and colder, because again, blood is being shunted to the core, so away from the extremities. That can result in a loss of coordination, also muscle fatigue. Trying to keep the head above water can be difficult, especially if you don't have a flotation device. And eventually that can result in stage 3 hypothermia, like we discussed previously. And then also stage 4, which is called post-rescue collapse. So even once a person is pulled from the water, they're not out of the neck of the woods. There is still a risk that it could potentially be fatal. Unfortunately, about 20% of survivors who are pulled after experiencing immersion hypothermia, it can actually be it can be fatal. 20% can actually die shortly after rescue. The reason for that being that being submerged in the water, that hydrostatic pressure that's on the body, when that's suddenly taken away once the person is pulled out of the water, it can result in a sudden drop in blood pressure. That the heart is not effectively able to pump blood to the rest of the body, to the extremities, also up to the head, to the brain, of course, because the heart is cold, and it can't effectively pump blood to where it needs to bleed. It can't maintain blood pressure. Like I talked about earlier, with the cold shock, kind of gulping that air, gulping that cold water, I should say, sorry. The water can cause damage to the lung tissue itself. This can result in almost like a pneumonia-like illness, like an acute respiratory presentation. So to kind of help with survival times, like I mentioned, having a personal flotation device can be useful, like a life vest, an immersion suit, a dry suit of some kind. Proper clothing can also be beneficial as well too. Either wool or synthetic materials make a difference as well too. Not cotton, because cotton, once wet, does not help with insulation, keeping heat on the body. Also having a means to signal rescuers, like either a strobe light, a whistle, flares maybe. In some cases, having like a waterproof radio, depending on the type of work setting, just to radio for help. And also having a means of being retrieved from the water, trying to get out of the water can be helpful as well too. If you do have a personal flotation device down at the bottom here, while you're in the water, because that device is going to keep you buoyant, it's going to keep you above water, to kind of help conserve with heat, there's what's called the heat escape lessening posture, HELP position. Basically, what you're trying to do is bringing your knees up to your chest. You can even cross your legs to help you maintain that position. And then, like you can see in the figure here, if you can see my mouse, crossing your arms and then grabbing each side of the flotation device and just holding yourself in that almost like pseudo-fetal position. That can help you conserve heat while you're waiting to be rescued. If multiple people are involved, then you can kind of gather together and put your arms around each other, pull yourselves in tightly close to each other, just so you can conserve on body heat that way until you're able to get rescued. All right, frostbite. Basically, this is a type of injury that occurs with freezing of the skin and also the underlying tissues as well. So there are 3 stages, 3 degrees of frostbite. Frost nip, which is occurring more at the surface of the skin, like you can see in the figure here. You might notice redness of the fingertips. Also, they might feel sore to touch. Superficial frostbite, which results in pins and needles, almost like a tingling sensation. That's actually affecting more of the superficial layers, the epidermis and the dermis layers of the skin. And then stage 3 is deep frostbite. So this is basically resulting in numbness of the fingertips due to the shunting away of the blood from the extremities. So the skin will actually become very dark in color, almost black. And this is a full thickness. It's affecting the epidermis, dermis, and also the subcutaneous tissue. So it's basically the deep frostbite, the most severe form of frostbite, of course, because at this point it's causing permanent tissue damage. So as the lower the temperature, the more quickly frostbite will occur. It can affect all extremities, especially the hands, the feet, but also the nose, ears, and chin, cheeks as well too. They can also be affected by frostbite as well. In severe cases with deep frostbite, excuse me, that might actually require amputation in certain cases, depending on how severe the frostbite is. And like I mentioned, we've kind of gone over the symptoms here on the lower portion of the side. So what to do in this situation? Again, very similar recommendations as compared to hypothermia. You want to get this person help ASAP, emergency rescue staff, call 911, of course. With the affected areas, you don't want to rub or massage them because depending on the degree of frostbite, that could cause even further damage to those areas, especially if you do see blistering, like you can see in the photo here on the right. You don't want to pop those blisters because that can actually result in potential for infection, of course, even damage to the underlying tissue as well. And it's important you want to try to help the person get warm, but you want to be careful with how quickly you're rewarming them. And the main reason for that is because if the frostbitten area is rewarmed and that area does freeze again, if it does become frozen again, that can result in more tissue damage, especially because of the blood flow in and out of those areas. It could result in a perfusion injury. So that's why it's often safer to have the frostbitten area rewarmed by medical professionals. But it's okay to try your best in the meantime. You don't want to use hot water. Warm water is okay. But if you don't have access to water in the area where the person is located, the area can just be loosely covered and just protected from contact. You don't want to use heating pads or a heating lamp, or even if there is an external radiator available, like a heat generator or a stove, fireplace. You want to be careful with warming those areas because depending on how numb those areas are, a person might not actually feel the degree of heat that they're being exposed to. So they could actually burn those areas. There could be um, uh, some uh, some burns that could occur to those sites. And although it's not absolutely necessary, but if possible, if the person is having frostbite in the feet or the toes, you want them to avoid walking because that can put more pressure on those areas. And if available, giving the person warm beverages, if they're alert, is completely fine because again, you're warming those core areas, the core body temperature. Warming the core body temp, bringing that up is going to allow the body to shunt warm blood back to the extremities and help with perfusion and increasing the body and increasing the temperature in those areas as well too. All right, trench foot. Another name for this is immersion foot. So this is caused by prolonged exposure to both wet and cold temperatures, but it can occur at temperatures as high as 60 degrees Fahrenheit, especially if the feet are constantly wet. So that's why it's considered a non-freezing injury. Why this is considered a cold injury is because, like I had mentioned earlier, uh, with wet surfaces on the body, they can lose heat about 25 times faster. So as compared to dry feet, wet feet are going to lose heat much more quickly. To prevent heat loss, like we've discussed before as well too, blood is going to be shunted away from the extremities, so that results in constriction of the blood vessels, like you can see here in the figure. A lot of wrinkling of the skin, because again, the blood is being shunted back to the core. And basically, this is resulting in a shutdown in circulation of the feet itself. So with prolonged shutdown of that circulation, the tissues in the skin are going to start to die due to the lack of oxygen, nutrients, and also the buildup of toxic byproducts as well. So the symptoms that you'd see, of course, redness initially, that can eventually progress to a dark color, like dark purple, blue, or even gray areas of the foot, like you can see in the photo. Those can be signs of gangrene, basically tissue necrosis occurring. Also cramping, swelling, blistering as well too. Like you can see in the photo, there is some signs of ulcer formation on this person's foot, and even some, you can see a blackish tinge here to the person's toe as well. Again, signs that gangrene may be occurring as well, especially given the very gray coloring to the rest of the areas of this person's foot. Again, what to do immediately, you want to call 911, get medical assistance ASAP. If the person's feet are wet, if their shoes, boots are wet, their socks are wet, remove them, have them exposed. If you do have anything to dry the feet, that is ideal. Prevent any further heat loss from those areas. And of course, you want to avoid walking just to avoid any potential tissue damage too. Now, I know I have been saying for the past few times, like you immediately want to get medical assistance, call 911. It's especially concerning with these conditions, just given how quickly things could progress, especially if you're not able to get that person's temperature up in those areas, especially with the core temperature. With trench foot, like I said, it can result in gangrene in severe cases. With frostbite, especially deep frostbite, where it could potentially cause areas to become necrotic, might necessitate amputation, which of course you want to avoid. And with severe hypothermia, the person could fall into a coma, potentially not being able to recover, and it being a fatal experience. That's why you really want to get these people to an appropriate healthcare facility as soon as you can. All right, lastly, chilblains. So this is basically a condition that's caused with cold exposure, causing damage to the capillary beds. It's more superficial in the skin itself. Very small blood vessels in the skin, which can occur with repeated exposure. Temperatures can be just above freezing or can be as high as 60 degrees Fahrenheit. Initially, you might notice some redness, maybe some itching in the area, and then potential blistering and possible ulceration in severe cases. So like you can see in the figure, there is some ulcer formation. What you want to do in this case is, of course, slowly warm the area, avoid scratching. If available, steroid creams can be used to help relieve the itching and swelling. And you want to keep the blisters and especially the ulcers as clean as possible and as covered as possible, just so that there's no chance of any exposure to potential infection and just to avoid any potential damage there. And with chilblains, not only can this affect the toes, but also the fingers. Other areas that could be affected are the capillary beds in the cheeks and also the ears as well too. So risk factors for cold-related injuries, of course, work outdoors, like I said, especially in the winter months. So like agricultural work, construction work, electrical and pipeline utility workers, these would be at the most risk, depending on what sort of precautions they have in place, what safety precautions their employer might have for them to help combat the situation. Wetness, Being wet, damp, also a risk factor just due to the increased heat transfer from the body. Also, dressing inappropriately, not wearing winter appropriate clothing, big risk factor as well too. Also in the work site, if there isn't a source of heating, like an area where workers can get warmed, or generally speaking, like if a person's home isn't adequately heated, that could also be a risk for hypothermia as well, or cold-related injuries. Poor physical conditioning and exhaustion, also important risk factors as well too, just because the body may not be adequately able to react to cold exposure. Age also a big factor as well too, especially with the elderly and also the very young. Alcohol use can also make one more susceptible to cold effects. Why is that? Uh, the main thinking behind that is because alcohol actually will dilate blood vessels. So especially with blood flow to the limbs, to the extremities, it might increase blood flow there. So you might momentarily feel a bit warmer, due to the increased blood flow to those areas. But because the blood vessels are dilated in the periphery, the core body temperature might actually be lowered, because the body isn't able to keep its core warm with the shunting of the blood. So that's why alcohol is typically not recommended. So in terms of warm beverages that you might provide to a person, definitely want them to be non-alcoholic, of course. In terms of health conditions, of course, hypothyroidism and diabetes, those can have impacts on the thermoregulatory um, uh, mechanisms that the body naturally has, and also hypertension as well too, another common risk factor, just because that can also have an impact on circulation, and again, with blood flow in the body during homeostasis when trying to combat the cold. One's living situation can also be an important risk factor in general. If a person is homeless, has no shelter, and like I said, for the workforce as well too, especially in the agricultural setting, if they're just out in the fields, if there is no warm area that they can go to take a break, that can be also an important risk factor for cold-related injury. So what to do about the situation? I'm going to talk about this in the next couple of slides. I just broke it down briefly into things employers can consider and also what employees can consider. I kept it a bit briefer just to, keep on time. I know we have about 5 minutes left. So just to dive in real quick, in terms of types of prevention, if you were here for my heat presentation, I just went over these really quickly, keep in mind primary prevention, that's focusing on preventing a disease or injury before it even occurs. Secondary prevention is basically the injury has occurred, but how do we reduce the effects, the impacts in the short term? And then tertiary, in the long term, if this is going to be ongoing, lasting effects, what can be done? So most of what I will talk about, you might notice, will have more of a primary prevention skew to them. So from an employer standpoint, what are things that you can do? Of course, absolutely important. You want to train workers to be cognizant of what to expect in that cold environment. They should be aware of, what cold stress is, what injuries and illnesses to expect, common symptoms, how to prevent cold injury. If first aid is available, where they can access those resources. So for example, thermometers, cold chemical packs, hot packs, blankets, where are those located at the work site? And also what appropriate PPE is available. If there are external radiators that are available, portable heat generator units, how those can be transported and how to mobilize those. The employer should make sure their workers are aware of where to access those resources. In terms of engineering controls, like I said, radiant heaters can be used to help warm workers in secure stations. You want to be safe about where workers are using these heaters. especially in like a wet, damp environment, especially given the electrical hazards that might be involved. Also, if possible, if one is able to create almost like shielding to kind of shield the work area from drafts or wind chill, that would also be useful as well too. In terms of administrative controls, kind of safe work practices, of course, with physical labor, it's easy to become dehydrated. And then being in a cold environment, that moisture is also going to be a risk factor for developing a cold-related injury. So you want people to have access to warm beverages, not only to stay hydrated, but also to keep warm. In terms of heavy work, trying to do that during the warmer part of the day or even the warmer season. For example, if maintenance of equipment needs to be done, trying to schedule those during like the spring, summertime, as opposed to the winter time would be more ideal. And also with heavier work tasks, if kind of rotating those assigned tasks, like having a job rotation or using relief workers just so people can kind of switch out, take a break in a warm area, then come back and get back on the job. That would be ideal. Having assigned workers in a buddy system would be ideal as well too, just to make sure they can check on each other, especially when they're on the job in that cold environment. And lastly, yeah, like I had said, we're taking frequent breaks in warm areas. For those who are new, or maybe they're returning from break, kind of getting them adjusted to the cold environment would also be ideal as well too, just to get them adequately situated, especially if the cold work is going to be for a prolonged amount of time. All right, in terms of employee recommendations, as an employee, of course, yeah, if your employer is offering cold stress training, you definitely should make sure you're utilizing it. Definitely making sure that you know where things are located, what to do in that situation, monitoring your own condition, as well as, keeping an eye out on your coworkers, especially since you're all out there in that cold environment. Take regular breaks to warm up, dress properly, which I'll talk about in the next slide. Staying dry in the cold environment, any moisture, even sweating can increase the rate of body loss, heat loss. So that's why it's always handy for workers to keep an extra pair of clothing, on hand in case you need to change once you get wet. Drinking warm fluids. If that's not something that's being provided by your employer, having a thermos, would be ideal, just so you have your own hot beverage handy that you can sip on while you're working. Avoiding touching any cold or metal or wet surfaces with the bare skin. That's also going to help eliminate or reduce the exposure risk to the cold environment. And then, yeah, any sort of engineering controls, safety precautions, safe work practices, and PPE provided by your employer. As an employee, just making sure you know how to use those properly. All right, just have a couple of more slides here. Dressing properly, probably the most important thing that you can do, in my opinion, to prevent cold stress. Type of fabric makes a huge difference. So like I said, with cotton, it actually loses its insulation value when it becomes wet. So you want to try to invest in more materials that are either wool, silk, or synthetic. Even if those are wet, they can retain their insulation. You want to try to create at least 3 layers of loose fitting clothing, because with layers, that helps with better insulation. And also with the layers too, it also can help trap air and warm air, kind of creating that extra barrier as well too. So the inner layer is basically trying to keep moisture away from the body, trying to keep the body as dry as possible. The middle layer is providing some insulation. Even if you do get wet, that's bound to happen, of course. You're bound to get wet, especially dealing in like actively snowy environments with outdoor work. And the outer layer, this is basically providing like rain or wind protection and also provides some ventilation to prevent overheating. It's okay to take layers off and then put them back on if you are getting overheated. Once you feel cool again, put that layer back on, of course. You don't want to wear anything tight because that can reduce circulation to the extremities, and again, prevent circulation from like adequate warm blood flow from where it needs to go. Avoid wearing wet clothes. Like I said, carry a change of clothes. Wearing a hat or hood, keeping your head warm can actually make you feel like your whole body is getting warmer as well too. You can even use a knit mask, like you can see this gentleman here in the photo on the bottom right. You can cover your mask, cover your mouth, face, and even wear a hat on top of that type of mask, especially if you're dealing with like extremely cold conditions, I should say. And in terms of gloves and boots that you're using, if they can be insulated and also waterproof, that would be ideal. So in terms of cold policy, this will be pretty quick too. Right now, OSHA actually doesn't have a specific standard that covers cold exposure. But like I mentioned on the slide, employers do have the responsibility to provide workers with a place of employment that is free from recognized hazards, including cold stress, which are causing or likely to cause death or serious physical harm. This is as per Section 5A of the OSHA standard of 1970. So even though there isn't a standard in place, when I did my heat presentation last year, I actually spoke at NICOSH. It was the New York City um, Occupational Safety and Health. They had like a heat panel that discussion. There was one person who was talking about the legislative aspect. So they mentioned that in addition to a heat policy, they did include a cold policy section with that proposal for submission. Unfortunately, it wasn't accepted that way. They actually did have to remove the cold policy section, and it was mainly because the state wanted to focus on heat exclusively. The heat policy they were trying to emulate is the California heat standard. In case you might remember, only 3 states right now have a heat standard in place. It's California, Minnesota, and Washington. Whether or not New York will be one of the next states remains to be seen. That heat policy was submitted last year for New York State, so we'll have to see what happens. But the person who was presenting last year during that heat panel discussion mentioned that there was still active interest in having a cold policy for New York State, especially when you consider upstate New York, the Buffalo, Syracuse area, Ithaca, closer to Canada, of course, they are going to have higher or amounts of snow, a greater cold exposure in those areas. So it would be good to see. So there is interest in trying to get a cold policy in place. So there is some hope there. Hence the smiles in this photo I have down at the bottom. So yeah, just as a quick summary, like I said, cold exposure can pose a significant health risk. It can even be fatal, especially for those working in cold conditions, depending on what other safety measures are in place. Just in my own opinion, I think having a better standardized reporting system in place can help with reporting to better estimate what the incidence and prevalence of these cold-related injuries is. Of course, this is going to vary based on region, depending on what each region considers cold exposure to be. And of course, even though there is no formal cold policy in place, employers should train workers on the hazards that are present on the job and what safety measures are in place, both engineering and administrative controls. Administrative controls, those are going to be a lot more easier to implement versus engineering controls, of course, depending on the physical environment. All right, so that's pretty much what I have. These are just some of my resources that I used. The Environmental Protection Agency, also NOAA, National Oceanic and Atmospheric Administration, great resources for weather information. They also do have links to some health information, which is great as well too. National Weather Service as well, good winter education there. Cleveland Clinic, Mayo Clinic also had good health resources in terms of the medical aspects of cold stress and cold exposure, in addition to the CDC, of course. and OSHA as well too. So I do apologize that we went over. Right now, I'll just leave it up to any questions or comments at this point.